Welcome to this episode of NLN Podcast Nursing EDge Unscripted. I'm your host, Dr. Stephen Palazzo, a member of the editorial board for Nursing Education Perspectives. In this episode, we will discuss how bullying behaviors may contribute to medication administration errors. My guest today is Dr. Dawna Rutherford, adjunct clinical instructor at Salem State University in Salem, Massachusetts, although I believe she's actually in Ketchikan right now. We will discuss their innovation article, Bullying Behaviors in Clinical Settings, Potentially Harmful Distractions. This article can be found in the July-August issue of Nursing Education Perspectives. Well, welcome. How are you today, Dr. Rutherford?
I'm well. Thank you for having me.
Oh, you're very welcome. Thank you for letting us meet with you and have a discussion about the work that your team did. If you could start off and just let us kind of define for our audience how you all define bullying behaviors and how they may contribute to distractions in the clinical setting.
Okay. Well, bullying itself, it kind of encompasses a range of disruptive, repetitive, and ineffective behaviors. For example, criticism, humiliation, negative activities, all perpetrated by an individual of supposed power. There's usually a power imbalance, and it's targeted against. In our instance, we were looking at it. Was targeting nursing students. So what's interesting, I've had people ask me, it's like, well, you say it's repetitive. Nursing students aren't in the clinical setting
Right.
every single day. However, what we did, our team did, we took bullying behaviors, which would comes to like the criticism and things of that nature, and took that little snippet, and that's what we used to do our simulation.
And I'm assuming during the pre-brief of the simulation or before, students were introduced to the concept of bullying behaviors and what that looked like in the clinical space and what that entailed definition-wise. And I'm sure some of them have already felt like they've witnessed or experienced themselves some of those bullying behaviors.
What's actually interesting, when I brought them into the simulation, that we withheld from them. We introduced that we want to see how they would perform basic medication administration. We used students that had already successfully passed medication. And then we looked and said, hey, we're just seeing how you do how the process is done, how you are doing this. They did not know that we had an actor, or we had several different actors come in and pose as the nursing instructors.
Oh, good. So they weren't prepped beforehand. They were
No,
separated. The groups they were separated into, I think there were three groups. So
correct.
the intervention group with the bullying behaviors was the one where they didn't know they were going to have somebody play a role of a bullying person in the role.
Right,
Okay.
correct.
Yeah, that makes
Yeah,
sense.
yeah. And there was one group, there was no intervention. We just had someone introducing a distraction. She played a
Right.
nurse that was like my little chatty Kathy, and I didn't realize the person could talk so much. She was a wonderful actress, and she just would talk. However, the interaction with that type of distraction was entirely different than what transpired when we saw those that were actually experiencing some bullying behaviors. Yeah.
Well, though there were no significant findings between the three groups as far as the distractions or the bullying behavior, what was interesting finding that I thought was that the exposed group to bullying distractions finished their medication administration in a much shorter time than the other groups. What did your
Yes.
team attribute this finding to?
Well, that one, it was kind of sad. And it's just like, oh, it's almost like that fear, anxiety. It's like, well, let's hurry up. Let's get out of here.
Right.
That fight or flight. And it's like, oh gosh, it's more of a flight. And that's where looking at it now and looking at it a little more in depth, is like, wow, that could be dangerous. You know,
Yeah,
rush,
oh, for sure.
yeah, I mean, you're rushing through a medication administration, something as quote unquote simple as administering insulin. Insulin's not simple. um, Giving too much insulin, you could actually harm a patient.
Yeah.
You could
Yeah.
kill a patient. I mean, so yeah, rushing through a certain task just because it's like, oh goodness, this person's hovering over me, or they're just like, oh, you're taking so long. You don't know what you're doing. And I even have one of the participants say, I've done this before. It's like, but I just couldn't think.
Right. You lose focus and concentration, especially if you feel you're being intimidated, right? Uh,
Exactly.
with a
Exactly.
distraction. So although you didn't find that the distraction led to a medication error, you did find that those who were in the bullying behaviors, I'm just reiterating, finished in a significantly shorter amount of time than the other two arms of the study. And it was a small sample size. So obviously you probably didn't have enough power to capture something with that
Exactly.
small, but that's something interesting to take further with a larger group of students in multiple settings, and see if that shows up again, what those findings were. I would be really interested in it. I think many people would too. So that was a very interesting point, I thought, when I was reading the article.
Yeah.
How would you suggest an instructor build a similar scenario in their simulation lab? What would you
Mm.
change in the delivery of the distraction, or did you feel the distraction was distracting enough? Which you just kind of mentioned that the actor did a really good job at being very chatty.
Well, there in the healthcare setting, there's so many different distractions. It all depends on how you want to educate your population. If you're like, well, on the low end, hey, this is how you deal with distractions in general. So you can kind of structure it that way. It's like, okay, yes, we have phones in the hospital. Well, you may need to put that to the side, especially if you're a brand new nurse or if you're just a student. Students cannot have them in the clinical area, but sometimes all of a sudden you see this little phone coming out. But training is like, hey, these things need to be put away for a
Right.
reason, not because we don't want you to have technology. It can also be structured where those that are performing the bullying, oh goodness, you can have them just kind of be like a little gang.
Yeah.
One time I actually described someone as, remember the movie Mean Girls? Doesn't
Hmm.
necessarily has to be women or men, but mean people, where they're just grouping around, kind of gossiping, just even just the chitter chatter. It's like, are they talking about me and things of
Right.
that nature? So it can be introduced that way. I mean, there are so many different ways you can take this.
What was the role of the actor playing the bully? Like, what bullying behaviors did they manifest when they were interacting with the students?
We had to keep it pretty low key because we did not want to cause, I mean, physical harm or anything of that
Oh,
nature.
of course, yeah.
So what we did one time, the gentleman, he's like, I described what we needed. And he's like, I'll just be on the phone, pretending that he's on the phone. And he's just like, oh, yeah, you know how these students are. They
Hmm.
just take forever and ever. This one, she doesn't even know what she's doing. Just those small little zingers, those,
Right.
and that's when it's like, is this really happening to me? So that's how he introduced it. And there was actually one student who pushed back. He
Oh,
also, yeah, he had a different, he had life experience. Let's just say life experience. I remember it, but he pushed back and it's like, excuse me, you're supposed to be here to help me. It's like, oh, okay, very good.
okay.
So,
So there
yeah,
was some built-in resiliency potentially from already previous exposure or life experience that they seem to be a little bit more equipped to handle the situation.
exactly.
Oh,
So, and this type of simulation, I would love to see with brand new grads,
yeah.
due to the fact that, okay, they have this wealth of knowledge that they've already gotten from school, but how are they going to be able to integrate in the real world with what's really out there? I mean, it's fortunately right now where I'm at, it's a wonderful place, but there are some places that are not so wonderful. And
Right.
these brand new grads are walking in. It's like, oh gosh, what have I gotten myself into? So, yeah.
Dr. Rutherford, how would you suggest an instructor build a similar scenario in their simulation lab And also, what would you change in the delivery of the distraction? Or would you
Mm,
change anything in the delivery of the distraction?
Delivery of the distraction to keep it low key and safe. I personally would not do any changes. They could, if they wanted to, have additional people
Okay.
instead of just one, because I only had one person who was introducing the distracting behavior slash bullying behavior with one student. I would love to also see, hey, maybe they could develop it where there is just the instructor or someone who is um, doing a check off, but have another student, like a pair, a buddy with them while they're
Hmm.
there, because not everybody is outspoken. Maybe having two people there will kind of protect each other and keep
Right.
them on track. That's another way. And even if they want to do further research in this, would that make a difference, especially if they're a brand new nurse or even just a student nurse? The buddy system.
I assume there's education around this topic then for these students. It's not an isolated situation where they go into this simulation lab and experience this, but there is education around it.
Correct. Um, those that had the intervention, that was the intervention for those that were in that particular arm of the um,
Right. For
yes,
the
that
study.
was
But I was
correct.
wondering if these students would also get that same type of education after the fact and be exposed to the same strategies for dealing with those type of behaviors.
I personally think that would be ideal. And I also think that this type of education needs to be kind of woven into the curriculum.
Mhm.
So they have that additional information to kind of armor themselves, have a toolbox of things to go from point A to point B.
Right.
So
Well, I
yeah,
want to Well, I want to thank you so much for joining us today in this conversation. I really appreciate your time and your expertise in broadening our understanding of this work and how we can begin to introduce some of these strategies in our own institutions and programs. To our listeners, if you have not already had the opportunity, please take a look at the author's work, Bullying Behaviors in Clinical Settings, Potentially Harmful Distractions. And the article can be found in the July-August issue. And Dr. Rutherford, again, thank you so much. Thank you for joining us from Ketchikan, Alaska.
thank
Appreciate your time.
thank you so much, sir. You have a great day.
You too.